Well, the more patients you see, the better doctor you become, right? No, not according to a new Harvard Medical School study. It says younger doctors often provide better care than older, more experienced colleagues. Joining us this morning, Dr. Harry Fisch with the Columbia University Medical Center in New York. Nice to see you. Thanks for talking to us. This seems completely contradictory. I mean, the first thing you do when you run out to find your doctor is someone who's experienced, who's done a zillion surgeries, who's delivered a million babies. So isn't this report, the study, essentially saying, no, inexperienced is the best?
Well, it's not really true. You know, the recommendations of the study are fine. That is, as we get older, as we are longer out from medical school, we do need to have continuing medical education, keep on learning, but the reality is the conclusions of the study may not be perfect.
Walk me through the study. It's called a meta-analysis. What exactly does that mean?
Well, it's a sort of a meta-analysis where they looked at studies in the literature over a 40-year period to determine whether knowledge-based information is really maintained as physicians get older. And the issue there is, they looked at all sorts of studies. The main issue is, as you know, as you get older, you may not be able to take tests as well as younger people. So there are some confounders, some things that really can adversely affect the conclusions of the study. For example, if you were to take an SAT test today,
I'd ace it today.
A 16-year-old may do better than you, and you know, what does that say? It says they could do better on exams, but not necessarily as smart as you, as capable as you are, and as experienced as you are.
Are there any medical fields or general medical areas where actually younger doctors do better, that it's not sort of this contradictory thing?
Well, there may be progression from the technical experience you get right out of medical school, the knowledge and the professionalism and the humanistic approach to medicine as you get older. There are certain surgeries that may lend itself more to a younger doctor. There are new surgeries such as laparoscopy, where a small incision is made, a tube is placed in the belly, and it requires a lot more experience. It's a new procedure that younger doctors may have the experience there. But that doesn't mean they make better doctors. The older doctor, while may not be able to perform technically that surgery as well, may have a better experience in understanding when to operate and when not to operate.
So at the end of the day, if you're looking for a surgeon or an obstetrician or whatever, do you want to look for number of surgeries or numbers of babies delivered? Or I mean, is that how you would advise patients to find these doctors?
Absolutely. It's all based on experience. If there's a new procedure and you have an older doctor that's up on that, that's fine. But in general, it's all experience.
All right, Dr. Fisch, nice to have you. Thanks for talking to us.
Thank you.
Appreciate it. Bill?
Get a break.